Although most elderly individuals remain mentally alert until death, some experience periods of confusion and disorientation. Signs include lacking awareness of location or time, forgetting, for example, forgetting family member names, locations, events, even the person can reach to the point of forgetting his or her own name, abnormal speech, sudden changes in emotion, such as sudden agitation and hallucinating. Delirium, which is when confusion or disorientation is temporary condition caused by a treatable condition. Reasons for delirium vary. For example, it can be because of a certain medication or drug toxicity, alcohol or drug overuse, a medical condition such as a stroke, heart attack, lung disease, liver disease, or even an injury from a fall. It can even be caused because of a chronic or terminal illness. Elderly individuals are also more sensitive to medication and drugs, which can sometimes accumulate in the body and cause confusion and disorientation. Even poor nutrition and lack of fluid intake can interfere with mental ability. Identification and treatment of any of these conditions decrease and even eliminate the confusion and disorientation. For example, changing a medication or giving it a smaller dose may restore normal function. But at the same time, disease and damage to the brain can sometimes result in chronic confusion and disorientation. For example, a cerebrovascular accident or a stroke, which damages the brain cells. A blood clot can obstruct blood flow to the brain, or vessel can rupture and cause hemorrhaging in the brain. Another one is arteriosclerosis, which is a condition in which the wall of the blood vessels they become thick and lose their elasticity, and it's very common in elderly individuals. And as a result of the thickening of the blood vessels, this causes it more hard for the blood to flow to the brain. Dementia, which is also called the brain syndrome, is a loss of the mental ability characterized by a decrease in intellectual ability, loss of memory, impaired judgment, personality change, and disorientation. Now, when the symptoms are caused by high fever, kidney infection, dehydration, lack of oxygen, drug toxicity, or other treatable conditions, then we do call it delirium, which is what I mentioned at the beginning of the video, or also we can call it acute dementia. However, when the symptoms are caused by permanent, irreversible damage to the brain cells, the condition is called chronic dementia. Like, for example, the cerebrovascular accidents that I mentioned. The last cause I'll be mentioning is Alzheimer's disease, which is a form of dementia that causes progressive changes in the brain cells. Individuals with Alzheimer's disease, they lack neurotransmitters. Neurotransmitters are chemicals that allow messages to pass between nerve cells in the brain. The lack of neurotransmitters results in the death of the neurons and the development of amyloid plaques and neurofibrillary tangles. Alzheimer's disease can occur in individuals as young as 40 years of age, but frequently occurs in those who are in their 60s and 70s. In my opinion, if we're going to be thinking about Alzheimer's disease and how it's going to be affecting the body, then we have to really think about the brain parts. Because let's say the damage occurred in the occipital lobe, or occurred in the cerebellum, or in the temporal lobe. That means the patient is going to be losing balance, vision, and hearing. Whatever the cause of the confusion or disorientation is, certain courses of care should be followed. For example, removing any dangerous objects away from them. And in severe cases, special sensors may be attached to the leg or the wrist of the disoriented individual. Following the same routine is also important. And lastly, reality orientation consists of activities that help promote awareness of person, time, and place. The activities can be followed by anyone caring of the confused individual, whether the caring is at home or in long-term care facilities. Thank you so much for watching, and I wish that you learned something new today.